Welcome back. In this section, we're going to continue learning about the respiratory system, and we're going to start with structures of the head. So if you put the tongue on the roof of your mouth anteriorly, you can feel that it's quite hard. It's hard because this is the place where you have the palatine process of the maxilla as well as the palatine bone located. So this is the hard palate, which is kind of the dividing line between the nasal cavity above and the oral cavity below. So looking in, continuing posteriorly, once we are out of bone, we are then in the soft palate area. Looking at the nasal cavity, what you can see is there are some curves in there because we have some bony protuberance which are now covered by mucous membranes. The lowest of these, the most inferior, is called the inferior nasal concha. There's going to be 3 of these. Never try to figure them out from the top because not all models in every cadaver is it very easy to see the highest one. So always start with the lowest one, the one closest to the hard palate, and that's going to be the inferior nasal concha. Just superior to that one, we would have the middle nasal concha. And so, whereas the inferior nasal concha was its own separate bone surrounded by soft tissue, the middle and superior nasal conchas are actually portions of the ethmoid bone. So that's the middle nasal concha. Whoops, went the wrong direction. And right up there at the top, that's the superior nasal concha. So notice how much smaller that is up there. Now let's move to the throat, the back of the throat. This is known as the pharynx. And it starts in the back of the nasal cavity, does the back of the oral cavity, and continues inferiorly. So we can divide the pharynx into 3 areas. So this is a close-up of the pharynx. And so there's a couple of landmarks we're going to be using for doing our dividing. And one of them is this area of the hard palate going to the soft palate. And another one is here's the hyoid bone, and this is a piece of cartilage whose name we will learn later. And I'll be showing you where the lines are, where the dividing lines are between the 3 sections. Your textbook also has really good pictures highlighting the 3 different areas. So the most superior section is called the nasopharynx. Notice it's naso with an O and not nasal with an AL. So this is the area that's just posterior to the inferior and middle nasal conchas and is above the level of where the palate is. In the nasopharynx, there's one really important structure at the end of each arrow, and that's the opening of the Eustachian tube. So if you remember, the Eustachian tube travels through temporal bone and opens into the middle ear, and so, which is air-filled. And so this is the other end, so that the air entering the nasal cavity, the pressure of that air is going to be the same pressure entering the middle ear, so that you won't have pain in your ear from differences in pressure. All right, so that's it for the nasal pharynx. So keep the bottom border of the nasal pharynx, and that becomes the upper border of the next section. And this middle part is called the oropharynx, O-R-O, not O-R-A-L, oropharynx. And then continuing inferiorly, just posterior to the opening of the larynx, we are going to have the laryngopharynx. So it's real important you learn how to spell larynx and pharynx. And remember, all 3 sections of the pharynx have an O before the word pharynx. They're all one word. Okay. Other structures that are in the head are actually related to the lymphatic system. You may not have known that, but you do know about them in general. Your tonsils. So if I was to ask you how many tonsils you have and where they are, you'd say, well, you have 1. Well, you'd say you have a pair, 1 on each side, and they're in the back of your throat. And I would go, okay, but you've got a lot more tonsils than that. Okay. The first tonsil is located in the nasopharynx. And it's kind of where right at that upper corner of the posterior wall of the nasal cavity. And because it's in the nasopharynx, it's called the pharyngeal tonsil. So if you ever heard of somebody having their tonsils and adenoids removed, this is the part that's considered the adenoids, but we're going to call it the pharyngeal tonsil. Please don't write adenoids as the answer for anything. Going back towards the oropharynx is where we're going to find our next set of tonsils, but they're not in the posterior wall. They're actually on the sides of your neck, internally going towards the midline, and these are the ones that you recognize as tonsils. And so they're not very impressive on the model because you're looking at them from the side and you're not getting any idea of how big they protrude. And really, in some people they're quite small, and other people they're quite large. So this tonsil, the tonsil that you've known about, is the palatine tonsil because it's associated with the palate. Now there is a third set of tonsils. Have you ever noticed, like when you get sick and it feels like your tonsils are all swollen, it's difficult to swallow, that it feels like the back of your tongue may be swollen too? It's because it is, because that is where the third set of tonsils is located. And this is called the lingual tonsil. So in the body, there is no groove, but in models, I will say they usually have some kind of groove or indentation for you to realize, okay, you're posterior enough. And then just above where the tongue attaches, this is the part that is called the lingual tonsil. Back there. So with that, we are done with respiratory related structures of the head, and I will see you as we continue our exploration of the respiratory system going in an inferior direction.